In recognition of Urology Awareness Month, I am going live every single day to discuss a urologic issue of interest to everyone. And I hope this topic regarding vasectomies will help some of you. For those of you who don't know me, my name is John Lin. I'm a urologist at Sunrise Urology right here in Gilbert, Arizona. I'm very, very honored to be the #1 vasectomist in Arizona. This year, I'm slated to perform about 1,200 vasectomies, and I'm not aware of anyone who does more vasectomies than I do. As such, a lot of my patients will ask the same questions over and over regarding the vasectomy procedure. So I figured today I'll cover some of those tips, tricks, frequently asked questions. And as usual, if you have any questions, please leave them in the comments below, and I would love to help you out and try to answer some of those questions regarding vasectomies. Okay, let's get right into it. All right. Vasectomy should be considered a permanent form of sterilization, meaning if you're thinking about banking your sperm or thinking about reversals, I tell my patients you probably shouldn't have a vasectomy if you're thinking about having more children or preserving your ability to have children. It should be considered a permanent form of sterilization. Even though it is reversible, there's no guarantee that you can successfully get someone pregnant after a vasectomy reversal. So if you're thinking about having a vasectomy, please think of it as a permanent sterilization technique. In addition, before you undergo vasectomy, you definitely want to talk about it with your spouse. Even though I do not require permission from your spouse to perform your vasectomy, it's always a good idea to discuss that with your spouse, right? Happy wife, happy life. That's what they say. All right. I know this is probably pretty obvious, but vasectomy is not a way to prevent sexually transmitted infections. So vasectomy is just used to prevent pregnancy. It does nothing to prevent you from getting an STI. You definitely want to take precautions if you are single and maybe you had a divorce. Typically, that's what happens. Divorced guys, older, coming in, they're done having children, and they come in for their vasectomies. It is not a form of protection against sexually transmitted infections, so make sure you're not thinking that as a way to prevent infections. All right. Some of the most commonly asked questions are, 1, will vasectomy cause a change in my sexual function? And the answer is no. It does not cause any difference, make any difference in the amount of stuff that comes out, even emission. It makes no difference because most of what comes out is not blocked by vasectomy. So it will not cause any change in the amount of semen that comes out. The amount of semen that is contributed by sperm is very minimal, and you will not notice any difference in the quantity or the quality of the semen that comes out. So rest assured. Second thing that guys may ask is, well, is this going to change my sexual desire? Is it going to change my testosterone level? And the answer to that is also no. See, testosterone is produced by the testicles, but it's delivered to the body through the bloodstream. During vasectomy, I'm not doing anything to your bloodstream. I'm simply blocking the tube that connects from the testicle to the other ejaculatory ducts. So your testosterone level is not going to change, which means your libido, your sex desire is not going to change. Okay. So other things that guys may ask is that going to cause a change in my ability to urinate? Well, absolutely not. Testosterone, semen that's conducted when I do a vasectomy, it's not affected. The urination is not affected by the interruption in the sperm flow going from the testicle to the ejaculatory ducts. Your urine goes through a common tube, but it's a separate mechanism, so it does not interfere with urination at all after your vasectomy. Some of the guys may ask, well, do you use clips? Do you put in some sort of a metallic clip when you perform the vasectomy? Now, this is individual. This is very different for another urologist possibly, but I have seen other patients who had a vasectomy done by some other urologists, outside urologists, who used metallic clips, and they complained that they could still feel the clips in the scrotum. And that's why I do not use metallic clips. That is something that I do not use, and everybody does it a little bit differently. But in my hands, I do not use metallic clips when I perform vasectomies. Instead, I use sutures, which you most likely are not going to even know that they're there after I perform the procedure. And one of the other questions that guys may ask is, do you have to remove the sutures after I perform the procedure? And the question is no. First of all, there are no sutures on the skin. The skin is closed with what's called steri-strips, these tiny little pieces of tape to close a tiny little puncture wound in the scrotum. And I do everything through one tiny little puncture, okay? So that is closed with steri-strips, tiny little pieces of tape, and there are no sutures to remove from the skin. And the sutures that I do use are inside the scrotum, and they remain there. They get dissolved over time after your body forms a scar to block the vas deferens. So there's nothing to remove when it comes to sutures. All right. So hopefully that answers some of the questions that you all may have regarding vasectomies. And if you are interested in reading about vasectomies, you can go to sunriseurology.com, click on patient information, and go to the forms tab. Under that, you will find vasectomy information sheet that goes over everything about vasectomies, the way we do it right here at Sunrise Urology. So if you're interested, click on that link. As usual, any questions, comments, leave them below. Take care and have a good one. Bye-bye.